Today I talk about delusional misidentification and especially about Capgras and delusions and Fregoli delusions. And my name is Heun. I'm a consultant psychiatrist and editor of Global Psychiatry Archives, and we follow a series, Mental Health Explained. So come back to delusional misidentification syndromes. There are usually symptoms of underlying disorders such as schizophrenia, delusional disorder, or other organic disorder, and can happen in dementia. They're usually part of other delusions and part of schizophrenia, so they're more symptoms than independent diseases. So the most common one is the Capgras delusion, which was called after the Capgras, and in this case, the patient believes others have been replaced by near identical imposters. Could be animals, could be family. I recently had a case like this, and it was a 60-year-old woman, and she felt that the family were not the people who they would be, and they were imposters, and she saw it by finding that they had specific habits which they never had before. They might eat, and they did eat, or that's what she said. They did eat something they wouldn't have eaten before, and they would have smiled in a way that they never did before. So she was looking very carefully at these family members. Well enough, this responded well to risperidone in a low dosage. Okay, so other delusions are the Fregoli delusion, and so they feel that someone else is someone in disguise. So that they feel that a person who they met or who they see maybe in the neighborhood might be a previous enemy, and this enemy is now in a different person and is trying to follow the patient. Quite rare, happens, and the interesting part is that we very often, as psychiatrists, don't use the Fregoli or Capgras delusion as in description, but very often would say Mr. or Mrs. So-and-so feels that there's an imposter who prosecutes them. There's sometimes a very rare delusion, which is the metamorphosis. Metamorphosis means change, so that some people are just morphing into something else, so that the whole process is just ongoing instead of being finished. The other thing which is more common is the syndrome of a doppelganger. Doppelganger is a German word for a double, and so they believe that someone is a doppelganger, a double person, and it could be even themselves, but that's even more rare. That's what they call as Autoscopic syndrome. So the patients see themselves as the doppelganger of another person. Patients might feel that they are imposters, and they might be replaced by others, so that they are not real. There's also something what they call reverse Fregoli syndrome, so that other people have caused this and made them to be misidentified or having changed their personality. So how does it get there? There are different theories, psychodynamic or biological. So the psychodynamic theory says that there is an intensive focus or stress and intensive focus on details. I told you before that about eating and having a specific habits of smiling, which might or might not have changed. So intensive belief, strong emotions about the family might have caused that. That was the case in this family where there was some arguments and which then led or at least triggered the delusions of the patient. That it might be seen as a defense mechanism of projection or splitting to deal with difficult emotions in the family situations. There are also biological symptoms in a way that some patients who have these delusions, specific delusions, have organic brain disturbances. In many cases, or in some cases, there's right hemisphere dysfunction, there is anterior cortical atrophy, some temporal lobe pathology, could be a stroke, or bifrontal disconnectivity could also be a stroke. So some of them you can find in patients who have not just one, but usually a series of strokes, that their perception of the reality and their friends and neighbors is changed. So what you need to do, you need a full physical and psychiatric assessment. And if I were to see something like this, I would certainly recommend to have good imaging, at least a CT and better an MRI scan to see what happens in the brain. Patients should be supported, things should be clear, no jokes should be made about making funny comments that could destabilize and irritate the patient. And in many cases, antipsychotics are very helpful. I hope you learned a little bit, and even though it's quite unusual, it might be interesting. Thanks for your interest. Bye-bye. If you like it, please subscribe or like our channel. Thanks.